Hi, I'm Dr. Steve Coates. I'm a clinical neurophysiologist based in the UK. I'm also the CEO of the charity TeleEEG. Today, I want to talk to you about TeleEEG in general, but also our experience of TeleEEG in Ecuador. And I have nothing to disclose. There 65 million people worldwide live with epilepsy. Most of these live in low and middle income countries, and of these, 3/4 are not treated adequately to contain their epilepsy. This is a busy slide, but it's often used to show the disparities in the treatment gaps between various countries. It's based on a systemic review in 2009, which was quoted by the World Health Organization Bulletin in 2010. We focus onto the right-hand side of the slide, you can see that the high-income countries have treatment gaps less than 10%. Ecuador is classed as a middle-income country, and depending on the data, the treatment gap is anywhere between 30 and 80%, still pretty poor. Some of the countries on the left side of the slide have a treatment gap of 100%. Why is this treatment gap large? Well, individuals with the skills to diagnose and treat epilepsy are in short supply generally, but particularly in under-resourced countries where you may not even have a neurologist or a clinician trained in epilepsy in the entire country. There's a general lack of medical equipment in some of the low and middle income countries, and in particular EEG machines. Epilepsy is, of course, a clinical diagnosis and will rely heavily on the history and clinical examination. But there are other investigations which are also important. Bloods, EKG, imaging in particular circumstances. And also today, of course, a lot of people have access to smartphones with videos, and video recording of seizures can be useful to the managing clinician. And finally, we have EEG. The EEG equipment itself has advanced over the last 100 years, whereas previously it used to be a paper recording on big machines. Nowadays, the EEG can be carried out on a laptop. And this is what we strive to produce: an EEG of good quality. So a routine EEG should answer the 4 questions. First of all, is it epilepsy or is it something else? If it is epilepsy, is it focal epilepsy or is it primary generalized in nature? Or is it an epileptic encephalopathy? This is what the World Health Organization has to say about the use of EEG for routinely diagnosing epilepsy in non-specialized healthcare and low and middle income countries. However, now we have the internet. At TeleEEG, we use technology to try and help reduce the treatment gap. So we provide laptop-based EEG machines to clinics in need. We train the local staff to produce routine EEGs on their patients. Also, if local expertise for interpreting the EEGs are unavailable, this can be provided remotely by uploading the EEG to one of our servers, where one of our volunteer interpreters will read the EEG and send the report back to the clinic. So this is a map of the world showing some of the poorer nations in orange and red. The TeleEEG service was initially established in response to a request from Nepal in 2012. At the time, there were limited epilepsy services in Nepal and only a few EEG equipments based in Kathmandu. However, word got round and the demand for an EEG service grew. So today we have over 40 clinics in around 26 different countries. And we've reported over 15,000 EEGs worldwide. Our metrics compare pretty well to those of high-income countries. Latin America in general carry a significant treatment gap, and Ecuador in particular. So Ecuador is one of the smaller countries of South America. It's in the northwest. Its landmass is slightly greater than the UK and has got a population of 17.7 million. Quito is the capital, and Tena, the place that TeleEEG visited, is southeast of the capital. Ecuador generally is noted for its beauty and for its biodiversity. Ecuador is notable for its burden of epilepsy and also for its geography and demography. Ecuador is part of Latin America and the Caribbean, with 6.34 million people living with active epilepsy. Latin America and the Caribbean countries rank third in the epilepsy global burden of disease. That's behind sub-Saharan Africa and Central Asia. A recent paper on the burden of epilepsy in Latin America and the Caribbean called for telemedicine, among other tools, to help improve epilepsy care. So access to care in Ecuador is in part limited by its geography. There's a mountainous terrain, with the capital Quito being at 9,000 feet. Sometimes roads are impassable due to landslides. As far as demography is concerned, although Spanish is the official language, there are 13 other indigenous languages. Also, 37% of its population live in a rural setting, which is associated with an increased treatment gap. Thanks to the work of the International Neurology Foundation, we at TeleEEG were invited to go to the hospital Jose Maria Velasco Ibarra Hospital in Tena. And this is a 100-bed hospital with a catchment population of around 280,000. So we installed a Cadwell 3 EEG machine, and we trained 3 ITU doctors, 6 interns, and 6 pediatric doctors and nurses on carrying out routine EEGs and uploading these EEGs to our server for analysis. Although there was a language barrier, it was overcomable, but there was an issue with the availability of staff. They have to balance their training with clinical commitments. Usually we would train staff for 2 days solid, carrying out multiple EEGs on as many volunteers and patients as we could get. However, in this case, some doctors and nurses were only available for afternoons. Another limitation was that clinicians routinely carried out their own investigations rather than delegating. So they would carry out phlebotomy and EKG. They would therefore carry out their own EEG. Now that of course meant that they were away from clinical work on the ward during this time. Nevertheless, I'm pleased to say that the first TeleEEG upload from Tena Hospital was carried out on the 2nd of February 2022. Summary. There's a large treatment gap in low and middle income countries. Ecuador has got the largest burden of epilepsy in Latin America and Caribbean countries. And the treatment gap can be potentially closed by the intelligent use of technology. There's still a long way to go. At the moment, we have 48 hospitals in 26 countries awaiting our help. I'd like to also take this opportunity to thank our partners who have helped to make our work possible, and also our volunteer consultants who've given their time in reporting EEGs from clinics in the developing world. So thank you for listening, and I would be happy to take any questions.